Hello, my name is Dr. Barbara Rodwin, and I'm here to talk to you about what we do in order to help with shoulder problems. If you haven't checked it out, there are other videos on our website and on our YouTube channel on the shoulder, and one of them is on scapulothoracic motion, and that has to do with 2/3 movement normal from the shoulder and 1/3 through here. And when we have shoulder problems, we start to compensate by using different muscle groups and joints back through the upper back and shoulder blade. And I'm going to show you what I do in order to actually help with that. Now we're going to actually look at what we do in order to help with shoulder problems, because normally with shoulder issues it's not just the shoulder itself, it's actually things through the shoulder blade, which is known as the scapula, the middle back, which is known as the thoracic spine, and the lower part of the neck. So as a chiropractor, when I assess the shoulder, I actually check shoulder blade motion, arm, upper back, and neck too, to be able to see if there's any compensation occurring. And I'd say 95% of the time people have started compensating with this area, and this is the area that gets missed. So what I'll normally do if we do need to work on it is I'll actually take and lie a patient on their stomach, so just pretend this is the patient, and I'll check the movement of the upper back, because the upper back needs to move with the shoulder, because when you move the shoulder everything moves through here. And I'll often actually take my hands and adjust this region, adjust the bottom part of the neck, and then normally with the shoulder blade we can lose movement of the shoulder blade. As you can see, this piece of the shoulder blade comes into the collarbone, which is all attached into the shoulder, and we'll often lose the movement of the shoulder blade, and I'll actually have to do adjustments on it either with my hands to take it a certain way, so I'll put my hand on it and do that, or I'll take this instrument, it's known as an activator, and I'll use it on part of the shoulder to get the movement. It doesn't hurt, it's spring-loaded, and I'll often use, a day doesn't go by right now, especially with the rounded posture everybody has now, where I am using, this activator to adjust the shoulder joint. Because what does happen is we actually move our shoulder and raise it up in this fashion, the shoulder joint moves and the collarbone rotates, and we have to actually get all of this to move properly together. And that's what I'll often do for adjustments in through here, the shoulder blade, the upper arm, or even the humerus, the upper back and the lower neck. And then when we get the motion of this whole thing together, presto, the shoulder is a lot better. The other thing we do too is I do active release through the different tissues that are in through this region that tighten up. There are videos on our website about active release, so feel free to check them out.